Right, good day and thanks for joining. I'm Elisha Road. I'm one of the medical officers at the Department of Urology in Grooteskier Hospital. And today I'd like to open an important dialogue, in my personal opinion, one which I think we really need to talk about more as health professionals, and that is how do we approach acquiring knowledge. This is specifically going to use urology as an example, but I think it relates to a lot of fields, and I think that it's also relevant to a lot of other disciplines. Now, I think this is such an important dialogue for a number of reasons. The first is that it's an important dialogue because as medical doctors, and especially postgraduate doctors, we've come through a situation where we've had to learn how to learn in non-ideal circumstances. And by that I mean we've come through studies where we had a large volume of content we had to get through, whilst at the same time juggling clinical work and at the same time also managing our lives. And I love that because it not only has exposed us to developing our own study methods, but it has also forced us to find efficient and effective ways to get through material. So that's why I really looking forward to opening this dialogue and looking forward to engaging with you all on this topic. So in preparation for this topic, I was reminded of an old TV program that used to be on TV in South Africa, and that was called the Reggie's Rush. Now, Reggie's is a South African toy store, and back in the day, one lucky kid would be invited to this Reggie's Rush, where they would have a set amount of time to run through the store and just collect as many toys as possible. And this reminded me of sort of how we are taught we need to learn in sort of these idealistic or vacuum-like circumstances where you start a chapter and end a chapter in the same setting and you run through it trying to grab as much information as is possible. But I personally do not believe that this is realistic, as we cannot grab information haphazardly, and we also cannot retain that information either. So instead of this run and grab method, I believe that our ability or how we go about acquiring knowledge in an effective manner runs through a stepwise progression that starts with fundamental concepts, fills in gaps between those concepts, links the information to other knowledge that we have, and then finally reflects and delves deeper into sort of how we came about this knowledge and this understanding. So I've laid out this knowledge hierarchy, which, sort of is this concept that I just thought of and made sense to me about how I go about acquiring knowledge. And the first thing is, sort of we lay out fundamentals. Now, I've put this photo here of a structure on a lone island with a storm around it. And it reminds me of my kindergarten and Sunday school days when we talk about the parable of the two men who built their houses, one on the shore and one on the rocks. And the crux of the story is that the one who built it on a solid foundations, the house stood steady in the midst of the storm. Now, that's a good parable, a good little story, but I prefer the comparison of fundamentals to how we build massive skyscrapers and structures, where we use thin rods, very simple in structure, to create a meshwork. And from that meshwork, we fill those gaps with concrete or cement, and that provides a foundation for massive structures to be erected. And that's really how we gain our knowledge. Now, the core idea in fundamentals is we need to think about where does the conversation on said topic start from. And what I mean by that is if you view fundamental information as the minimum needed to have a conversation about that topic, you could also compare it to going to a dinner party and meeting people who don't work in a discipline such as yourselves. And you can strike up a conversation if you know the minimum about, for instance, if it's an IT person, if you know the minimum about sort of the latest IT, or if it's someone who does, for instance, who's interested in gardening, and you know the minimum to initiate a conversation. And that's what the fundamentals really is on any topic, is understanding the minimum to initiate the conversation with either your examiner or to initiate and the sort of building blocks for further knowledge. So to use this concept and illustrate it as an example, I've laid out two texts that I'd like us to consider. One you should probably be familiar with is the Campbell's, which is sort of called the Bible of Urology, while the other you may not be so familiar with, but it's the black text, and that is, for us as South Africans, that's our undergraduate textbook that we've all used. It's a very simple, very sort of to the point text. Now, when you're studying a text, and let's consider the Campbells, and you start reading benign prostatic hyperplasia, you can see that in the Campbells, it runs from page 1 to page 2 to page 3 and so on and so forth. But it's really intense with information. And I mean, this is important information, but there's a lot in that right now at this point, when you're just gathering the fundamentals, is extra, right? Now, if you consider fundamental texts such as the Introduction to Urology, I've laid out a few of my photocopied pages. And the point, if you can just ignore the highlighting, is that you usually have fundamental headings such as etiology, pathology, pathogenesis. And with that, you've got a few bullet points. Now, the value in having a text like this is that although there are also extra pieces of information here, by grasping the core headings, you're starting to lay down a framework. And from that framework, you can see some kind of core topics. So for instance, you'd read benign prostatic hyperplasia, and you'd see, okay, involving the etiology, there's an age component, there's some hormones involved, there's the epithelium and the stroma that have an interaction. You'll look at the pathogenesis and you'll see, okay, it involves the transitional zone, right? The obstruction to the flow of urine, there's a anatomical and a dynamic component, right? It's not, by no means is it complete, but you're sort of laying down a framework and so on and so forth. And these are sort of the remaining pages. You'll know that there are symptoms, and those are sort of mainly lower urinary tract symptoms. You'll know that there's a symptom scoring system, and then your eyes will scan. I think a lot of us are good at it at this point, but you're scanning for sort of keywords that highlight that this is fundamental or important. An example of that is sort of, if we just look at this text over here, we can see that under this heading, we've got a thing that says minimum requirements. And for a lot of us, that sort of triggers in our mind, like, listen, that is a minimum thing we need to know. We need to know that for these patients, we need to assess symptom score, rectal exam, urinalysis, urine flow, creat, PSA, plus minus a KUB. So your mind easily and quickly at this point of your life and your career recognizes these sort of core topics, and these start to lay the foundation for you. Right? And it can go on, and now you'll start to see sort of treatment modalities, and you'll know that there's medical, there's watchful waiting, and there's surgical. Now, the purpose of this fundamental part of learning is that you want to lay down sort of the core headings, and from that, just try and remember 3 to 5 points on that. Okay? And this is often the point that's a bit annoying, because you have to kind of rote memorize often here. But by rote memorizing, you're laying down pegs that eventually is going to be solid foundation to build on. And you also want to quickly move through the topic. So you're not going to spend forever. You're going to know what your headings are. And for many things, it's similar in medicine. So, you might be looking at a cancer, and, it's always going to have risk factors. It's going to have symptoms. It's going to have staging. It's going to have investigations. And so you're going to lay this down with a few key points, and then you're going to move on. And at this point, you should also have developed a system for reviewing. And there are many out there. There's some good videos on it also on YouTube. But whatever your system is, you're going to make sure that you come back and you review those fundamentals so that they start sticking in your long-term memory. Now, once you have those fundamentals in place, you're going to start looking to fill those gaps. And at this point, it would be good to go back to a sort of more robust and voluminous text such as the Campbells and go and read and sort of gain some more understanding. But another 2 manners in which you can do this is, number one, now you've got some fundamentals, and you'll go to the clinic and you'll start seeing patients. And as you're seeing patients, you're going to hit that sort of niggly area where you've got some theoretical knowledge, but you're trying to make it clinically sort of applicable. And as you do that, your mind's going to start to develop algorithms. And how you do that is, the first patient you're going to see, you're going to think, okay, I needed this test and that test and this test. And then you're going to see, but this is impractical. This I don't have to do. How do I get this patient to come on the same day and do this sort of test? And by seeing patients and trying to put into place these fundamentals, you're going to develop clean sort of algorithms in your mind, which is going to aid you not only in remembering the topic, but it's also going to aid you in efficiently and effectively seeing patients. The other way is that now you can refer to a text such as a guideline. Sometimes it can be international guidelines, or it can be a local guideline that you have. Over here, I'm going to utilize an example of the European Urological Association guidelines. And this is something that we tend to lean on. But what I like about this is when you go and review a guideline, it takes that information that is sort of theoretical and tries to bring it into what's practical. Now, I apologize, the quality of the image might not be that good, but what I'd like to highlight over here is that as you read a guideline, you'll start to see things that you've studied sort of from your fundamentals. For instance, in this text, you'll see, okay, wow, yeah, they're talking about the International Prostate Symptom Score. And look, there's a strong recommendation to use a validated questionnaire. So that reinforces in your mind, listen, okay, so there's some sort of scoring system that I need to run through these patients with, and that's sort of going to help me with treating them. And if you go to the next one, you'll see that, okay, look, they're recommending do a digital rectal exam, and it'll take you back to sort of what's the minimum requirements on these patients. Okay, we have to do an examination on them. Right, I need to make sure I'm going to do a digital rectal exam, and that's a strong recommendation. The other thing you'll remember is it said do a urinalysis. And here you'll see, okay, right, in the assessment of men with lower urinary tract symptoms, a urine analysis is a strong recommendation. And so on and so forth. And you'll also start to see things that's probably no longer important, or things that have to be tweaked or modified to make it applicable. So for instance, if you remember back to the basic text, it said that people should have a flow done, a uroflowmetry. And here you can see that it says here that perform uroflowmetry prior to medical or invasive treatment. And that's a strong recommendation. So now you'll start to grapple with the information to yourself, but okay, look, there were 3 ways in which you could treat these patients. There was the watchful waiting, there's the medical, and there's the surgical. So what the text or the guideline is saying is that for medical and for surgical, they need flows, but watchful waiting doesn't necessarily need flows. So now all of a sudden your algorithm is adjusting. You know you need to do an IPS score on these patients, an IPPS score on these patients, and you know that you're going to categorize them. What are you going to do with them? And now you know that also they don't all need the same investigation. So by doing this, the fundamental information is being revised, the gaps are being filled, and you're sort of strengthening the knowledge on this topic. So what we're trying to say with gaps in applications is this is the point in your learning where you bolster by filling the gaps, but you also correct and find the way in which it's clinically applicable, the knowledge. You also run through practical scenarios, and as mentioned, that sort of strengthens your memory, and you develop algorithms which not only help your memory on the topic, but also helps you to be clinically efficient when dealing with patients. And we know how everybody loves a doctor who can run through a clinic. So once you've done those fundamentals and you've started to fill the gap, the next step is you're going to look at the information and you'd ask yourself, but where else have I seen some of these things in the pathology? And by this, I'm trying to say that you look, for instance, at the clinical symptomatology, such as lower urinary tract symptoms, and you ask yourself, okay, what are the other things that can cause lower urinary tract symptoms? What are the other things I need to think about? You will look at the tests, such as PSA, urodynamic studies, and you'll think to yourself, okay, I know they're recommending it for benign prostatic hyperplasia, but which other disease entities? You know, and that's going to often link to other things that you might have read, or other things that you need to read. And it's a very good exercise because it starts to create sort of lateral connections in your mind. And you look at the drugs and you'll say, okay, tadalafil, I know it can be used in benign prostatic hyperplasia. Why can it be used here? But man, isn't this also used in erectile dysfunction? And so you strengthen these lateral connections. And the importance of strengthening those lateral connections is that if you think about it, it is often how oral exams go, is that you could be asked a question on a specific topic, but any information that you relay to the examiner could take them on a different trail, which could, for instance, take you from talking about tadalafil for erectile dysfunction to all of a sudden talking about tadalafil's role or potential role in benign prostatic hyperplasia. So it's a very important exercise, and this further strengthens your memory. Now, finally, once you have managed to lay a foundation, you've filled the gaps, you've started thinking about how is this knowledge applicable in other areas, you're going to come to a point where you're going to start delving into the advanced side of knowledge. And by this I mean you're going to go and look back and you're going to read the landmark papers, and often at this point you've come across certain studies that keep getting quoted, and at this point it would be a good idea to go and have a look at those studies and create a summary, you know, where you say, listen, this is a study conducted in 98, it was a randomized control, it's got about roughly 3,000 patients, and this is what they're trying to do. That was a placebo versus, for instance, let's say dutasteride, and it was a comparison, and these were the outcomes, and this is what changed our practice. All right, We'll also go and look at sort of theories into pathophysiology, so why do people get BPH? And sort of, is it just an enlarged gland? Is it just hormonal? Are there other components? And what are the theories behind that? And finally, there are also areas where you'll go and look at the historical perspective. You'll look at how was this treated before and why did we change that? And this is an important exercise because not only does it feed back into your fundamentals and adds another leg on which to rest that memory, but on top of that, often at the higher ends of examining, this is where they're going to take you to. They're going to take you to the hypotheses. They're going to take you to tell me about the landmark paper in this. Tell me about why we use this. What were the limitations to that study design? So this is an important and final sort of component in how we learn information. So these are my ideas. This is how I believe we sort of run through. I believe we go from fundamentals, we fill those gaps, we then try and find connections, and finally we look back and we try and think of how did we come by this evidence. And in so doing, we're constantly going back to the first step and building on the next one and building on the next one. And this creates a revolution through the knowledge that helps to really make it stick. I want to thank you for taking the time to watch this talk. I'm keen to hear your ideas in the comments section. If you don't want to leave a comment, you're welcome to email me, and I'd love to engage and just sort of hear your tips and tricks for acquiring knowledge. Thank you very much.